Hello and welcome to this week's episode of GIANT's Healthy Innovators TV. My name is Barry Shrier and I'm your host. To begin with, we'd love to thank the many thousands of viewers from around the world who dial in to visit us and to watch our presentations. We're ambitious to present to you some of the leaders in healthcare tech innovation who are working with us to achieve our vision. GIANT Health's vision is to improve the health and the well-being of people around the world by facilitating and promoting technology innovation and facilitating the adoption of new technologies in healthcare. So thank you to all of our listeners. We really love serving you and we're very keen to continue publishing these valuable episodes. If you like what you're doing, if you like what we're doing, please don't hesitate to like our YouTube channel and to subscribe to it. That would help us to help you. We'd also love to thank our sponsors. Today we have Chris from Totalmobile, and we'd like to thank Totalmobile, who's a valuable partner and sponsor of ours, and also Vodafone. So thanks you guys for sponsoring GIANT Health. We really love working with you guys, and we appreciate our valuable collaboration with you. So Chris, good to see you. How are you today?
Yeah, I'm good. Thank you, Barry. Yeah, nice to see you.
Excellent. Thank you very much for joining us. And Happy New Year, obviously, and best wishes for a valuable and healthy and safe 2023.
Thank you very much. Thank you. Yeah, fingers crossed.
Exactly. So Chris, a lot of the people that we bring on board have really interesting careers, not necessarily in healthcare only, but they've come to very interesting points in their career and they're working for very interesting businesses like Totalmobile. Very excited to hear about that. But if you don't mind, we'd love to hear about your personal journey to begin with. For example, have you always worked in healthcare? How did you get to where you are now?
Yeah, so it's a bit of a potted history, Barry. I actually spent first 8 years of my career in the military here in the UK. So actually working in the public sector, although a slightly different kind of branch.
Yes.
And then from there, I moved into software organisations. So spent quite a bit of time in mobile telephony. So when mobile phones were really kind of taking off in the end of the 1990s, early 2000s. Little bit of time in fixed line telephony, and then into SaaS-enabled software capability, and that's nice. Where I got into Totalmobile.
Okay.
And then within Totalmobile, obviously, I look after the public sector business unit, and for me, the public sector is something I'm really passionate about. As I touched on back at the start of my career, I spent 8 years serving the public. I would argue as part of the armed forces.
Absolutely. Yeah.
My wife has been a GP for 25 years, so I'm linked to healthcare through my wife. I hear about it most nights when I get home. So I kind of know a lot about healthcare, but haven't necessarily worked in it directly myself.
Yeah. Great to have it in the family, though. And my situation is the same. And so our children and my wife are also in healthcare. So I'm always saying that I am surrounded by all these healthcare crazies. But it's a great sector, isn't it? And
yeah, and I think when you have those interactions, you also get to see the kind of if you like the real side of it. There's one bit seeing strategies and presentations, but when you have loved ones who are doing it with a passion and that's what they're doing, you get to hear the real stories. What's really going on the front line of health.
Absolutely,
and is a real it's fascinating, but it's also a motivator because I hear some of those challenges and I think, well, how can we help with some of that?
Exactly, where the wheels hit the ground, as they say. And no, agree with you completely. Well, thank you for the introduction. We appreciate that. So tell us just very briefly about Totalmobile and your overall involvement in healthcare.
Yeah, so Totalmobile provides applications for field service management. So really for people who are working out in the fields, so not in an office, out delivering service out in the community. And that can be across a range of capabilities from, a clinician in healthcare, through to an engineer repairing equipment out in a different sector.
Oh, okay.
As I say, my focus is on public sector, and so if you think about the healthcare element of that, really what we're about is enabling community-based clinicians to deliver more care, higher quality care through the provision of our technology.
Okay. No, that's very interesting. Can we drill down onto that a little bit, please? So your focus within the healthcare sector is what type of healthcare workers, or which bits of the healthcare sector?
Yeah, so we primarily work with community-based trusts here in the
Okay.
UK,
Yeah.
but also with social care and with sort of care in the community, what domiciliary type care.
Right.
And that's obviously quite interesting as the UK forms ICSs, so this bringing together of both the NHS but also the community-based care to try and provide this end-to-end service. We have a foot in both camps because we work with the NHS, but we're also working with local authorities who are providing domiciliary care, reablement type care in the community. So those are our sort of main areas of focus in that sort of broader health environment in the UK.
Yeah. Oh, okay. Excellent. So what are examples on a practical basis? What exactly is your technology?
So our technology really doing a number of things. One, we have a dynamic scheduling capability which uses machine learning and other type tools to help us get the optimal schedule. So if I've got 150 district nurses and 1,000 visits to do, what's the best combination that gets the right clinician with the right skills to see the right patient or the right service user? So that dynamic scheduling is one element. And then once we've created that schedule, we're pushing details of the visit that needs to happen out onto a mobile application to the clinicians. So the clinicians have got all of the information they need at their fingertips to be able to give that, the best care they can as they go out to see those service users out in the community. So it's this combination of providing data for the clinicians so that they can maximize what they're doing out there, but also maximizing their time by creating an optimal schedule for those clinicians and getting the right person to the right visit.
Yes. So it starts with the scheduling. Where am I going today? Who am I seeing? What is the way of optimizing my day in terms of my journey and that type of thing? And then it's combining that with electronic patient records. Do I have access to all of the detail, all the data of the patient or the person I'm seeing?
Yeah. So what we're doing is we integrate with the patient record, and we're pulling the appropriate patient record data into a mobile application, so that when I'm out visiting that that patient, I've got all of the relevant data, but actually what we're doing is presenting it in a much more user-friendly way. So rather than me having to sit with a laptop and try and navigate my way around a complex patient record system, we're able to consolidate, well, what's the data I need today? I'm going out to visit someone who's been recently discharged after a hip replacement operation, and I need to go and dress the wound. What information do I need? I don't need everything in their patient record.
No.
I need things relevant to what I'm going to do. And that's one of the key things we're doing, is surfacing the right information so that actually I can be more effective as a clinician. I've got what I need, but I'm not having to filter through 20 years of medical history to try and get to what I need.
Oh, okay. So in that respect, would it look quite different from the electronic patient record that maybe my GP would see or a hospital doctor would see regarding all that, what looks to me like extremely complicated, detailed window after window after window of, for me, 100 years of history and things like that?
Yeah, so we're formatting that data for the device you're using. So if you're using a smartphone of that kind of size, or if you're using a tablet, then the form factor will be associated with the device you're using, and we're presenting that data in a much clearer, simpler way.
Nice.
And then the other thing we'll do is to help that process is think about the data capture. So we will try to make data capture, things like we'll use drop-down lists, we'll use speech to text recognition, we'll use radio buttons. So we're trying to avoid you having to sit there and spend a long time typing while trying to talk to a service user, a patient. And that's one of the things I see when I go out with clinicians. This sort of scenario of a clinician with a laptop sat on their knee, trying to balance it, trying to get some connection, looking at the screen while they're trying to type, and there's a patient over there that I'm not engaging with because I'm having to do this.
Exactly.
Trying to change that so that actually I'm looking at you and I can tap a button, I can add some data. It's making that whole interaction better.
Yes. That's fabulous. I've seen so many examples where the patient is kind of sitting there while the clinician has actually turned their back to the patient and is typing away, struggling with some computer operating system and interface. And so what you just mentioned in terms of the UX and the customization of that for whatever device the clinician or the community care worker is using, that's very, very clever. Have you guys struggled with that, or is that kind of your DNA? Is that whole interface issue?
Yeah, that's very much our DNA. I think what we try and do, we start everything we're doing with that field-based worker, with that mobile-based worker.
Okay.
But rather than being the opposite way around. So rather than starting with a sort of big back office system and then think about how I'm going to provide this to the field-based clinician, we start by thinking, what does somebody out in the field need? And we almost work backwards. So that's very much in our DNA, is how do we make this easy to use, intuitive for a clinician. In the end, the clinicians, be that a district nurse, a physiotherapist, a stroke specialist who's gone out to see somebody, they are absolute experts in the clinical side.
Yes.
What we're not expecting them to be is IT experts. So we want to make this thing as easy for them, as simple, so they can focus on what they're really good at doing and what they're passionate about, which is delivering care.
Yes.
Rather than thinking about, hang on, how do I navigate this complicated IT system? It's not what they came into medicine for.
Yes. Yeah, exactly. No, that's fascinating. And so I can just see the need for this is absolutely vast. Chris, thank you so much. I'm getting a really clear and interesting picture from this. So really good stuff. Could you give us some practical examples? I'm not asking you to divulge anything which is confidential, but can you give us examples of like the actual types of services you're working with, the benefits these people are seeing, current use cases or teams or that type of thing?
Yes, I mean, as I say, we will primarily work with community-based trusts. So I can think of a big community-based trust in the middle of the UK. I won't go any further than that.
No.
And what they've seen is that, so they've rolled out now to a number of different teams. But let me take their district nursing team. So going out and doing that kind of district nursing activity, they found that the nurses on average are doing 1.3 extra visits per day. So they were at kind of about 6 visits a day. They're now at 7.3. It's an average. Clearly, you can't do it, but you know where I'm going, Barry.
Yeah.
And if you extrapolate that out of a team of over 200, spending a couple of hundred days a year out delivering service, it becomes a huge number. I mean, they're up at over 300,000 extra visits, extra clinical interventions they can do per year. So that, if you think about the challenges in the NHS at the moment, backlogs, growing demand, that extra capacity is huge. So that's one example.
And did that come literally from the, what do you want to call it, the effectiveness of your algorithm saying to the community care provider, here's what your schedule should be today?
It's coming from two factors, I think. One is an improvement in the schedule. So making sure that actually I'm not going to point A and then coming back to point B and then going back to point A.
Yeah.
So that's a clear factor.
Nice.
There's a second bit in there, which is because we're providing all of the data they need through that mobile application, we also see those clinicians having to come back to base on fewer occasions.
Oh.
So they're able to start the day. I know exactly what I'm going to do. They spend the whole day out visiting patients and then finish the day back at home, rather than having halfway through the day I'm coming back into the into the hospital or back into the office environment to pick up some new notes or other data. So that's a second factor that we see, and I think those two are probably what's driving that extra visit a day.
Nice.
They're also seeing additional benefits, which almost, if you like, are associated benefits. So one of the things we're seeing is a far greater outcoming of visits. So one of the challenges we have in the health service is visits happening. So a clinician is going out and is seeing a patient, but that visit doesn't get outcome. There isn't a conclusion to the visit. And what our technology does is really help to drive the percentage of visits that get outcomed. And that outcome might be, I need a follow-up visit. It might be, I need to refer you to physiotherapy. It might be that I need you to bring you back into an outpatient clinic. But driving that outcoming means, again, it's just the whole system becomes more efficient. And that's another clear benefit we're seeing is increasing that level of outcoming of visits.
Yes, that's interesting. So it's not just the really obvious stuff like visiting more patients per day, which albeit is extremely important, but it seems quite clear and straightforward. But there are these, if you will, more nuanced benefits, which obviously do have big knock-on effects in reducing costs and improving outcomes, doesn't it?
Yeah, absolutely. And I mean, and you know, there are multiple examples. I mean, there's a very interesting one that we are working with a number of trusts at the moment where, particularly in mental health and in some other areas,
right,
we're seeing some of the care provision being supported by third sectors, so by charity organizations, by welfare organizations. One of the challenges is that if you've got a third sector coming in and helping, is how do you provide them with relevant information for a service user or a patient they're going to see, but without opening up to them the full patient record of that trust, which means this third sector person could suddenly see everybody's records.
Oh, okay.
And one of the things that, and this, this is an almost inadvertent benefit, is that because of the way our technology works, we provide the data you need for the visits you are allocated to, and that's all we're providing. So for the third sector, what we're able to do is give a very streamlined view that says, okay, if you're supporting a clinician to visit 4 different patients or 4 different service users,
yes,
you'll have the data for those 4 individuals, but you can't see anything else. And so from a sort of GDPR perspective, we give a very clean way of allowing non-trust employees to still be able to give support out in the community, but not exposing them to too much data. And that's a really interesting use case that we're seeing more and more trusts want to talk to us about at the moment.
Well, absolutely. And I'm assuming that area itself is growing where, what do you call it, the third sector, these third parties?
Yeah, third sector, I think we're seeing more and more of that, of charities coming in and starting, I think it's one of the ways certainly the NHS has to think about, how do we go forward, because the demand continues to grow, and actually, you have to think about innovative ways of providing that service. And if some of that is by using charities to help with some of that, then that's a very valid route. You've just then got to think about how do you correctly provision the data in that.
Yes, yeah, exactly. Well, it's fascinating, Chris. I mean, there's the obvious straightforward benefits, and yet there's so many additional benefits here to the, what do you call it? You call it a platform, what you're providing?
Yeah, it's a platform. We haven't, because we've got a number of different sort of products and capabilities. Obviously, we've talked about the scheduling element. We've talked about the mobile application.
Yes.
We also have things like, we have a lone worker protection app, which sits within that mobile tool. And again, is a, if you like, it's like a panic button. So
yes,
as sad as it may be, we're now in a world where at times, healthcare professionals out on their own are seen as a target by certain individuals.
Sure.
Particularly in certain areas you're working. If you're working with in mental health, you may be meeting people who have got some real challenges. So we have a capability as well that provides that lone worker protection. It's a kind of panic button that goes through to a 24/7 alarm receiving center that can bring the emergency services involved. So we're also providing capabilities that keep the clinicians safer when they're out in the community.
Yeah.
All of that sitting on a platform, really, Barry. It's the right way to think about it. It's a platform with some bolt-on capabilities, and people are able to pick and choose which of those capabilities they want to use.
Oh, okay. No, that's really helpful clarification. Thank you for that. What are other areas? What other areas do you believe could benefit from greater technology usage? Within healthcare, are you guys looking at other bits of healthcare you're not working in currently, or are you looking at expanding the what do you want to call it, the functionality of your platform for your current customers, or a mixture?
Yeah, I think it's a mixture. I mean, there are some interesting areas that we're looking at the moment. As I said at the start, our main focus is on community-based trusts, but we've just started working with some acute trusts because, again, we've realised that although it's an acute-based trust and therefore most of the activity is happening in that hospital,
Right.
they've still got people going out into the community. And one of the interesting use cases we're seeing at the moment is for stroke support. So
Okay.
people who have a stroke come into hospital, and it's quite important that they get medical care quickly after that stroke. So they'll often come into hospital initially, have that initial care to limit the impact and limit the damage that the stroke causes. But once they're stabilized, then they'll go home, they'll go back out into the community.
Sure.
But they'll remain under the care of that stroke team. And that stroke team are sending out multiple different groups. So they'll be sending out physiotherapists, they'll be sending out occupational health, they'll be sending out cardiology type activity.
Yes.
And what we've seen there is that, again, it comes back to that scheduling ability. They're often got highly skilled nurses sitting in that acute hospital, allocating out work manually to the stroke team to, right, okay, so Barry, you need to go and see Ethel today. Chris, you need to go and see. And again, what we're just implementing with a couple of trusts is automating that scheduling.
Sure.
So then those highly skilled nurses, you can get them back out doing what they're best at, which is providing clinical care rather than
Not doing electronic calendar map reading.
Yeah.
Oh, that's very interesting.
That's interesting. I think we're going to see more of that, more of how we can work with acute trusts as
Yes.
the sort of boundaries between what happens in a hospital and what happens out in the community starts to sort of spread.
Sure. Well, that makes an awful lot of sense. That's very logical, isn't it? Some of our viewers are from around the world, outside of the UK, for example. So, Chris, could you just clarify very briefly the difference between the community trusts that you mentioned and acute trusts?
Yeah. So I think if you think about the way health is set up in the UK, really there are three groups of trusts within the NHS. You've got primary care, which is really your GPs, your general practitioners, and that for most people is the entry point to health. You've then got what we would call an acute trust. That's really your emergency type hospital. So that's where your accident and emergency sits, but also your highly specialised clinical units, so your cardiology teams.
Oh, okay.
And then the third group will be community-based trusts. They're providing that community support, which, as I've touched on, it's district nurses, so people going out to visit people in their homes, mental health provision. So a lot of that happens in the community. I think the view is it's much better to try and support mental health patients out in the community rather than trying to do that within a hospital. So there's three sort of different categories in the UK which provide that end-to-end health support. So primary care, acute hospitals, and community-based care.
Yeah. Okay. No, that's a helpful clarification. I'm sure a lot of our listeners would appreciate that. Thank you. Well, look, Chris, I'd love to continue the conversation because this is extremely interesting and informative. I wish we could be having this maybe in a beer garden and have a pint and then just continue. It's that interesting, and you've shared a lot of really valuable content with us. Let's wrap up over the next 5 minutes or so. Could you talk very briefly about the future for Totalmobile and more broadly, the future of healthcare? What are some of the biggest challenges in society and healthcare? Where does Totalmobile fit in that? And are you getting more narrow as you're developing your business or branching out?
Yeah, I think from a Totalmobile perspective, there's probably two bits on that I'd touch on. One is, we're currently primarily UK based. Probably 80% of our activity is in the UK. One of the things we are now starting to look at is, how can we provide some of these capabilities abroad.
Sure.
And starting to see some more of that international activity. So that's certainly something I see coming in the next few years.
Nice.
From an organisation, we're very focused. We have 4 vertical markets, and we focus on those vertical markets. And we think it's really important that rather than trying to be a kind of jack of all trades, we want to focus on the verticals. So that's why we're structured in the way we are. That's why we have a managing director for each of the verticals. As I say, I manage the public sector, and I've got a team who are focused on the public sector in the UK. And it's I think that's important because it means we really understand the issues. We really understand health. We really understand government, and I think we can therefore provide a better service because we really understand the details. So
nice. That makes sense.
That's very important. I think when I look about the future of health, and I think certainly in the UK, one of the key things here is, and this will be true for lots of viewers from around the world, we are seeing growing demand from a health perspective, partly driven by an aging population.
Yeah.
Partly driven by advances in medication and medical support. So life expectancy increasing, and now there's all sorts of wonderful things we can do intervention-wise. But all of that just places more and more demand on the health provision. And you can't just keep pumping more and more money into it. In the end, somehow you have to start doing things differently. And I think that's a key thing here in the UK. And I think one of the differences we're seeing, and we can see that from the creation of these integrated care services, is how do we bring together both the hospital-based care, but also the care in the community.
Exactly.
Because it's often, if you can treat somebody at home, if you can treat somebody in the community, it's better for that individual. It also costs less. So
yes.
It's a win-win. And I think that's where I see more and more health is moving. It's not all focused around acute hospitals. It's about how do we provide care in the community? How do we provide medical support in the community? And so for us, of course, that's exactly what we do. It's about how do we help clinicians who are out in the field, out visiting patients in their homes, to provide the absolute best care they can without having to put somebody back into a hospital.
Exactly. Yeah. No, it's a really important challenge for society, and to be able to do what Totalmobile is doing with your platform, delivering more healthcare at lower cost, is fundamental, isn't it, for the requirements of society? So really, really interesting.
Yeah, and I think it just it's to me it's more healthcare. More cost effectively, but also it's a quality of healthcare.
Yes.
And that's really important to me. It's absolutely about delivering the ability to deliver more healthcare, but it's also about being able to deliver really high quality healthcare. And what I hope we can do is give clinicians the tools that allow them to deliver not just more, but better care. And if you can get both of those, more care and better care, then you've really hit the sweet spot.
Yeah, that's golden. Absolutely. Well, look, Chris, thank you so much once again. We're going to have to wrap up now. Do you have any final requests to our community? We have a lot of listeners working directly in healthcare, a lot of people across the whole healthcare sector in the UK. Are you hiring? Are you looking for investors? Are you looking for acute hospitals to talk to?
So I think there's probably a couple of things. We're always interested in talking to people who who have a passion for health and have got a view on how we help to take things forward. So really open to those kind of conversations. And equally, I would love to talk to acute trusts, community trusts here in the UK, or people abroad who believe we could help them deliver better care. As I say, for us, our passion is all about how do we enable more high quality care to be delivered to people around the world. So anybody who's interested in that and would like us to come and help, then always open to a conversation.
Excellent. Oh, good stuff. We'll make sure that the links to you and Totalmobile are at the bottom of the video so people can reach out and contact you.
Excellent. Okay. Thank you for that, Barry.
Hey, Hey, Chris, so good to speak with you. We're grateful for your time. I know it's quite valuable, and this has been an extremely interesting conversation. Obviously, congratulations on what you and Totalmobile have accomplished. Very impressive, very important for healthcare. So once again, congratulations and thank you for your time.
No, thank you, Barry. It's been great to talk.
Okay, excellent. Well, look, once again, this has been this week's episode of GIANT's Healthy Innovators TV. We've been very proud and delighted to be speaking to Chris Hornung from Totalmobile, a valuable partner and sponsor of GIANT Health, alongside with another important sponsor of ours, Vodafone. So thank you, Chris. Thank you to everyone from Totalmobile and Vodafone. And once again, to all of our viewers from around the world, we hope you like these videos and you find them interesting. Remember, please, if you do like them, to subscribe to our YouTube channel. As a reminder, we are GIANT Health. The website is www.giant.health. And we hope you'll interact with us on our website. And we hope if you are in Europe, you'll come to our annual event in November this year in London. I'm Barry Shrier. I've been your host. Thank you very much.